Welcome to video number 4 of my 8-part video series on renal pharmacology. This video is going to be about the side effects of high ceiling and medium efficacy diuretics. Let's start. Hi, this is Dr. Avinash. Welcome back. Video number 4, where we discuss the side effects of furosemide and thiazide like diuretics. Let's dive right in. So what are the common complications or side effects of high efficacy and medium efficacy diuretics? Well, both of them cause hypokalemia, right? Now, remember, nobody comes to the clinic and says, Doctor, I have hypokalemia. They always say, I have weakness or fatigue or I get recurrent muscle cramps, or sometimes the patient might present you with cardiac arrhythmias. Well, prevention is always better than cure. So whenever you're giving medium efficacy diuretics or high ceiling diuretics, we are expecting a hypokalemia to happen. So we recommend a diet which is high in potassium, or we tell them at least try tablets of potassium chloride. These are potassium chloride supplements which are available. If the patient is not really taking a high potassium diet or is not taking potassium chloride supplements, then you might have to add another diuretic, which is a potassium sparing diuretic. We'll discuss potassium sparing diuretics in my future videos. Simple. Second, remember, when you throw away potassium, you reabsorb sodium. So you take sodium, you give away potassium. What if potassium is less? Then you take sodium and you throw hydrogen away. What is H plus? H plus is an acid. So if you're throwing away acid, acid leaves the body. Is it correct? If acid is leaving the body, what remains behind? Alkali. And that's the reason why both high efficacy and medium efficacy diuretics can cause alkalosis. Clear? Salt is wasted. Sodium is going to get out in urine. It's not going to get reabsorbed properly. Despite the distal convoluted tubulin collecting duct trying their level best, a little bit of sodium extra will be wasted. Potassium will be wasted, right? Which means salt is getting lost, water is getting lost. There is acute saline depletion. Now, whenever patient sees that so much water is going away, he's going to feel thirsty also, right? And he's seeing that so much urine is getting passed, he will drink a lot of water. Now the problem is, the patient, when he's urinating, is not just passing water, he's also throwing away salts. But when he's drinking water, he's only adding water that dilutes all the salts in his blood. This is called as dilutional hyponatremia. Now this is not a good sign. This hypokalemia, alkalosis, dilutional hyponatremia will lead to problems of muscles and nervous system, because both nerves and muscles require electrolytes to work properly. So GIT and CNS will have problems. Person might complain of nausea, vomiting, diarrhea, or headaches, giddiness, weakness, paresthesias, abnormal sensations, pins and needles, numbness, that is paresthesia, and impotence in males. Even hearing loss is very frequent. See, finally, nerves, right? If nerves don't work, how will the person hear properly? Other common problems that every other drug has, allergic manifestations can be there. There can be hyperuricemia. There can be hyperglycemia. See, glucose intolerance will lead to hyperlipidemia also. Diabetes is a package. If you mishandle glucose, you mishandle lipids also. Simple. Some medicines will cause hypercalcemia, too much calcium in the blood. Magnesium depletion in both the cases will happen. Thiazides sometimes aggravate renal insufficiency. And if you do too much of diuresis, especially in cirrhotic patients, it might actually lead to hepatic coma. Diuretics should never be used in toxemia of pregnancy. They will only precipitate complications. Simple. So there you have it, the logical reasoning behind all the side effects of high ceiling and medium efficacy diuretics. Very easy to remember once you understand the mechanism of action and my other videos in this series. Let me know if you got everything in the correct way. If you have doubts, feel free to ask. I will be more than happy to reply. This is Dr. Avinash signing off for now. Take care. Keep rocking. Bye bye.